Guys, welcome back to Community TV Tips and Tricks to Living Your Best Life. In this video, I'm going to be talking about tips and tricks to master orientation. So, as you guys may know, if you guys have been watching my vlogs, at this moment in time right now while I'm recording this, I'm finishing up orientation, and I don't know. I have some tips to give you guys. A lot of tips to give you guys for orienting as a new nurse. And you know me, I'm gonna keep it real. I'm gonna keep it 100 real. So I'm gonna talk about the good and the bad and like what you guys can get out of that. So as you guys know, I've been a nurse for 6 years. So this is for people who have been a nurse for a long time, and for people who are brand new, fresh out of nursing school, and who has never done nursing. So it's gonna be kind of different. I'm gonna address both people basically. So my first tip when you are orienting as a nurse is make sure you come 15 minutes early if you possibly can. If you can, that's fine, but try not to arrive late. That doesn't look good. Another tip I want to give is people are watching you whether you know it or not, and that goes for when you're working too. You may be alone in the hallway, but trust me, people are always watching. It could be so quiet, people are always watching. So always make sure that you're doing the right thing and that you are trying to learn. Another tip I have is to bring a little notebook. I'm the type of person, sometimes it's hard for me to learn things when I write stuff down. Especially when I have to do something, I'm more of let me do it myself. You supervise and you tell me what I need to do wrong and right. I'm a doer. That's how I learn. I can't just write what you're doing and expect to do it. Like, that's how I am. But even if you are that kind of learner, make sure you write things down, because sometimes and that's what happened to me. If you don't write things down, people think you're not really taking it seriously. Like, oh, how are you going to remember all that? But I do remember all that because I'm a visual learner. Like, if I see you click this, and that, trust me, I'm going to remember. But, you know, at the same time, you have to remember when you're in orientation, that person who is orienting you and the facility, like, you're basically on a test. Like, they're trying to test you, trying to fill you out, seeing, okay, is this nurse going to be good for our facility? Does she take it seriously? Does she does this? Does she does that? So they're gonna be looking at that. So make sure like you are taking notes, even if you're not the type of person who likes to take notes in a little notebook. Make sure you have a little notebook to take notes down, and actually write things down that maybe we will forget, like numbers and stuff like that. But try to take as much notes as possible. It just makes you look more productive, even if you're not a note taker. Another tip is, that should be kind of obvious, but make sure your clothes, you come in clean clothes. Don't wear no strong perfume. Have your nails short, because some nurses that are training you, they may look at little stuff like that, like, oh, your nails are long, I guess you didn't come here to work, you came here to like chill, um so guys, just make sure you have girls, just make sure you have your nails short. Guys, make sure your nails are clean. Make sure your uniform is clean and ironed, and like, you are there to make an impression. Like, the interview process doesn't stop there. Think of it like this: like, when you finish this job, you want a reference. You want someone to say you're good. So that's what I definitely give you guys as a tip. Another tip is that try to learn as much as possible, try to soak in as much as possible, but also know that there are certain things you're just not going to know until you do it. And I just know that from experience, there are just certain things that you're not going to know everything. Like, you could orientate for, like, because especially if you're working in a long-term care facility or skilled nursing rehab facility, like, you're not going to know everything. You're just gonna have to learn. Some things you're gonna learn as you go. Like, some things, I'm not saying endanger the patient, but some things as you're working, then you ask the questions while you're working, like, how do you do this? But sometimes it's impossible to know every single thing. If they give you a longer orientation, like maybe 6 weeks, okay, but the most they give you orientation, especially in a long-term care facility, is 5 days. You're lucky, very lucky, if it's 5 or 6 days, and usually that's a new facility that has a lot of money. But a lot of the orientations that I've been to was like only 1 day, 3 days, something like that. But this place I'm at now, they gave me like 5-6 days, and I'm so happy I had these days. But at the same time, I'm ready to start. Like, I don't like the how can you say, the anxiety around starting. Like, I just want to get my first day over. I want to get my groove. I want to get into the groove. I hate being a new person. I hate being the new kid on the block. Everybody looking at you up and down, testing you out, saying, oh, who's this person? Because you are in that person's turf. Okay, so that gives me another tip. Like, make sure you're friendly to everybody. Even if somebody gives you attitude or whatever, don't give them attitude back. Just make sure you're friendly to everybody. Another tip is, with your orientee, like, try to follow exactly what they do. Like, I don't know, like, I just find that sometimes if you follow exactly what they do and how they do it, even if you're not going to do exactly how they do it, they're going to be flattered, and they're going to be like, oh wow, she really knows what she's doing, and they will say, okay, yeah, she's good. I feel like that's what that helps. But also know that don't beat yourself up if you made a mistake, if you don't get something, because I find that there's some people who orient you, like, they don't really want to orient you. Like, for example, the first day I came to orientation, which is today, not today, but last week, the lady, she was like, oh, I'm not orienting somebody new. Like, she made a whole fuss about it, and people were like, oh, don't mind her. That's just how she is. She obviously didn't want to orient me, and I barely even met her, and that's frustrating. So there are things that I see she didn't want to teach me. So what I did is that I went to another nurse and I asked them how to do this, how to do that, and I got notes from them. So know that even if you are assigned to somebody who doesn't want to teach you, which completely sucks, make sure you try to find another nurse to help you, or tell your director, like, hey, I'm not learning from this person. My learning style doesn't match with their teaching style, because being a good nurse doesn't necessarily mean that nurse is a good teacher. That person may not want to teach you. That person may think that, oh, you trying to get their job, petty stuff like that. You can't really focus on that. And that was the mistake I made. You can't really focus on that. You have to focus on getting the material, learning what you have to learn. So you just try to find other, like, if this nurse is not like, you could tell if somebody doesn't want to teach you. They're not going to blatantly tell you they don't want to teach you, but they're going to be like, it's just the way they act, they're going to be like, you could ask them, oh, how do you do this? And they're like, you just click this, click that, and then they don't say anything after that. They just keep clicking. I've experienced that maybe twice in my life, which was last week. And then a couple months ago when I was working in Brooklyn at a night shift. And that's why I stopped night shift, because I felt like I didn't understand. And I said I didn't want to put anybody in danger. And I worked the morning shift because there were more people to help me. So that's kind of tricky, if you're working night shift and there's only one nurse to orient you and she doesn't want to orient you. So I would definitely bring that up to my supervisor. Like, before, I used to be scared to speak up for myself because of politics, but I was like, I spoke up for myself. I told my supervisor, and she was like, you know what, try to learn as much as you can. Any questions you have, ask me. So that's what I'm doing for now on. And 48 laws of power, don't outshine your master. For my senior nurses who have been nurses for 10 years, 15 years, or whatever, 6 years, 5 years, 4 years, even though you've been a nurse for a long time, know that it is possible to learn something new, and know that don't outshine your master. That's law number 1 in the 48 laws of power. What do I mean by that? Is that some nurses, when they're orienting you, they don't want you to, I'm not saying act like you don't know nothing, because then they're going to be like, oh, this nurse doesn't know nothing. She's going to put patient in danger. I'm going to tell them that you shouldn't have hired this nurse. But don't be so quick to show off. Don't be so quick to be like, oh, I know how to do that. I know how to do that. I know how to do that. If they look like they take pride in teaching, then let them teach you, and then do it exactly how you know how to do it, and that's it, that's what I did, because I feel like some people really want to teach you. Some people really have pride in teaching you something. There is nothing wrong with that, but some people may be very sensitive and emotionally, like, you may be in a higher emotional level than them, and if you show them, like, oh, I could do this, I could do that, they could begin to resent you for that, because, like, you're not letting them teach. Some people want to feel important. So if you come across that type of personality, and you could sense that, like, the person really wants to teach you, really wants to teach you, and if you don't let them, then that's going to be bad for you. So if you sense like somebody really wants to teach something, let them teach you that, okay? You already know, like, for example, I've given a million G-tubes, but she wanted to teach me exactly how to give G-tubes. So I just let her teach me. And I was like, oh, okay. And I said, is that right? Is that right? And she's like, yeah, yeah. So, I let her teach me. I didn't give no attitude, no nothing. And I just let her, feel important, and I, give out a compliment here and there, like, oh, wow, and it's not like I'm being fake. I really do think she's a good nurse. I said, oh, wow, you're a good nurse. Like, I let her know what I genuinely think that is great. Don't give people fake compliments, because if people sense that, they're really going to hate you. But if I genuinely see something in my orientator, I'm going to say, wow, like, thank you for showing me that you're very knowledgeable, or I'm glad I'm assigned to you, or blah, blah, blah. And then that's how it is. And last but not least, sometimes when you're orienting, people may not like you no matter what you do. Like I said, you're taking their hours, and they think you're going to surpass them, especially if you're a young nurse and this and that. And with that, like, I don't know, like, I'm still figuring this out, honestly. You just got to focus on what you came to do. Like, you didn't come here to make friends, you came here for a job. That's why I always say, like, nursing is not the field that you come to make friends, because the culture of it is very, not in all places, of course, but in the places I have been, majority of them, that's how it's like. So guys, yeah, that is my tips for orientation. Make sure you soak in all the knowledge that you possibly can. Write stuff down. Also, be that person that you can help. Like, for example, my ADON is the person above me. So one of the nurses was struggling with the G-tube, and I saw my orientator, she got a G-tube declogger. I said, okay, I got it. And the other nurse was taking care of it. I said, no, I got it. And I went to take the clogger, and I helped declog the G-tube. So she sees that, I'm very, I'm like, okay, I even volunteered to stay later. I said, do you want me to stay later? I can stay later, this and that. I can do this for you. I can do that for you. So that she sees that I actually, I am trying and I want to learn. So yeah, guys, I'm not saying do those extra things, but I'm just saying those things work, and try to get as much sleep as possible, because when you're learning, your brain has to be turned on. So try to get as much sleep as possible. Try to get a balanced meal. Try to drink plenty of fluids. And yeah, so thank you guys so much for watching my video. If you guys have any tips on orientation, don't forget to leave it down in the comments below, and I'll see you later. Bye. Happy orientation.